STDs, or sexually transmitted diseases, are more common than you might think. They can affect anyone who's sexually active, and the symptoms aren't always obvious. Today we'll talk about what STDs are, how to recognize the signs, and when to consult your doctor. Knowing the facts can help you protect your health and take action when needed. Let's get started. What are STDs and when to see a doctor? 1. What are STDs? STDs, also known as sexually transmitted infections, STIs, are infections spread through sexual contact. They can be caused by bacteria, viruses, or parasites. Some of the most common ones include chlamydia, a bacterial infection that often has no symptoms but can cause serious complications if untreated. Gonorrhea, another bacterial infection that affects the genital tract, throat, and rectum. Genital herpes, caused by the herpes simplex virus, HSV, it leads to painful sores or blisters. HPV, human papillomavirus, the most common STI. Some types can cause genital warts or increase the risk of cancer. HIV, human immunodeficiency virus, a virus that attacks the immune system and can lead to AIDS if untreated. Some STDs are easily treatable with antibiotics, while others, like herpes and HIV, are lifelong conditions that require ongoing management. 2. How are STDs transmitted? STDs can be transmitted through different types of sexual contact, including vaginal, oral, or anal sex, skin-to-skin contact for infections like herpes and HPV, sharing needles in the case of blood-borne infections like HIV or hepatitis B. In rare cases, STDs can also be passed from mother to baby during childbirth or through breastfeeding. Understanding how they spread is key to protecting yourself. 3. Common symptoms of STDs. Many STDs don't cause symptoms right away or at all, but when they do, the signs can include unusual discharge from the vagina, penis, or rectum, pain or burning during urination, sores, bumps, or blisters around the genitals or mouth, itching or irritation in the genital area, pain during sex, flu-like symptoms such as fever, swollen glands, or fatigue, common with HIV or herpes. If you notice any of these symptoms, or even if you don't have symptoms but are sexually active, it's a good idea to get tested regularly. 4. When to consult a doctor. So when should you see a doctor? You should get tested if you're experiencing symptoms of an STD, you've had unprotected sex, especially with a new partner, you or your partner have multiple sexual partners, you've been told by a partner that they have an STD, you're pregnant. STD screening is part of routine prenatal care to protect your baby. Regular testing is crucial for early detection and treatment. Many STDs are easily cured if caught early. 5. How are STDs diagnosed and treated? Diagnosing an STD usually involves a physical exam to check for sores, rashes, or discharge, urine or blood tests to detect infections like chlamydia, gonorrhea, HIV, and syphilis, swabs from affected areas to test for specific bacteria or viruses. Treatment depends on the type of STD. Bacterial infections, like chlamydia and gonorrhea, are treated with antibiotics. Viral infections like herpes and HIV can't be cured, but medications can manage symptoms and reduce transmission risk. 6. Preventing STDs. The best way to prevent STDs is to practice safe sex. Here are some tips. 1. Use condoms every time you have sex. They protect against most STDs. 2. Get vaccinated for HPV and hepatitis B. 3. Limit your number of sexual partners and have open, honest conversations about sexual health. 4. Get tested regularly, especially if you have new or multiple partners. Remember, taking care of your sexual health is part of taking care of your overall well-being. Final thoughts. STDs are common, but they're also manageable and in many cases, preventable. Regular testing, safe sex practices, and knowing the signs can help keep you healthy. Stay informed and protect your health.